Hello folks, this is Harley and I'm going to walk you through a generic no-frills encounter in LibreHealth EHR. By the way, in different places in this EHR, you'll also see encounters called patient visits or just visits. Now we all know that doctors' offices differ widely in the tasks that occur in an encounter and who is allowed to do which tasks. In this video, I'm showing a very simple scenario that uses Libre's default access permissions for the different staff roles that are involved, with one exception. Libre as installed will not allow a clinician, for example an LPN, to edit medication orders or to see any other staff's encounter notes. But I've given our LPN those permissions. The high-level flow of this encounter goes like this. Front desk checks our patient in and assigns her to an exam room. Clinician takes vitals. Provider does a review of systems and orders a medication. A medication certified staff, our LPN, administers the med and documents it. Front desk person takes the patient's payment and checks her out of the appointment. One last thing before we start. Libre's accountability and auditing functions associate activities with the user who is logged in on the computer where the activity occurs. It is most convenient for each participant in the workflow to have their own computer logged into the EHR where they each do their work. However, if staff are sharing a computer, they must absolutely learn to log into Libre, do their work, then log out of Libre, leaving the computer for the next person to log in, do their work, and log out. I have only one computer to do this demo on, so in this video, through the magic of video editing, I'm going to do all that logging in and out, but you won't see it. Okay, here we are logged in as Walter O'Reilly at the front desk. A patient arrives, steps up to the desk. Radar has the calendar open and locates the patient's appointment. Walter assigns the patient to a room number, let's put her in room number 2, and changes the encounter status to arrived, which automatically creates, hits save, which then creates a new encounter form for this visit. Okay. Now these encounter statuses that you saw, let me just show you again real quick. These encounter statuses are adaptable. You can customize them to your facility's workflow and terminology. For this demo, I'm just picking from the ones that come installed that have the closest match to the activity that we're doing. Okay. Okay, now let's look at the flow board. This calendar, look at the flow board and see that the patient has been checked in, arrived. Current status time is how long this person has been in this status. They are in the exam room we put them in, and that this status was updated or recorded by Radar. Now, being the front desk person, Walter sees all the providers' appointments on the flow board. Individual providers can only see their own appointments. Now the patient is taken down the hall to the desk of Tom the LPN, who's logged in at the nursing computer. Tom has opened the patient's record and opened the current encounter. There it is. Let's minimize this record here. And he's going to add vital signs to the encounter. He's going to take the patient's vital signs and add them to the document. So on this menu here, the encounter menu, click on clinical and then vitals. Tom takes all the vitals and then clicks save. Now, if your LPN does anything else, like takes a patient statement of the current problem, they can add their own SOAP note for that. And when Tom's chart entries are all complete, he can digitally sign them. Now in this case, okay, and it locks them to prevent modification. So we're going to have Tom sign his vitals here. Right there is his password, and sign it. Okay, Tom Jared, e-signed log, signed on this date. Now Tom goes to the flow board. Let's minimize this. And changes the status to, bring this pesky little panel over here, to in exam room. Now, in real life, you could have had it say ready for provider or nursing done or whatever. And then he escorts the patient down the hall to the exam room 2. Dr. Apgar is sitting at the exam room computer with a patient's record open. So here we are, Dr. Virginia Apgar. And she's going to do a review of systems. Now let's minimize the patient summary screen for now. We'll be coming back to it. Pulls up the current encounter. On the clinical menu, select Review of Systems. Run through this thing, fill it all out. Anyway, on down to the bottom, fills all of this stuff out, and click Save. Now, during the exam, the patient complained of lower back pain. Now, the provider is going to write up the visit in a SOAP note. Excuse me, this one. SOAP. The doctor-provider really does need to remember to mention a medication if they're going to order one. Mention that in the plan. And click Save. Now the doctor is going to order the medication. She brings back the patient's summary screen. And let's minimize this for a bit. Under the prescription widget, do Edit. Add, and she orders the medication. Now, by the way, this is the same set of steps, adding a prescription, that you would use when adding historical meds, except you're going to unselect that currently active, okay? But this is an active medication, so currently active. Starting date, 11/17/2017, the provider there. Now with the drug, this prescription module is standalone and almost completely manual. Libre is compatible with various e-prescription services, which would provide all the HIPAA-required medication guidelines and contraindication alerts that you'd want, but this prescription module does not provide those. Okay? So, but anyway, it does have this convenient little search tool here. You can either manually type in the name of the drug, or you can click here and type in, let's go searching for methocarbamol, and do a search, and it will suggest trade names for you to select from. So let's use Robaxin, and select, and there's the name. Okay. Quantity, how many doses? 1 dose. Medicine units, of what strength per dose? 1 gram. Take 1 in solution. I am stat. Add to medication list, yes, and do not substitute for this generic medication. Click Save. Now to the fee sheet. Bring back the encounter. This is where we record the charges for services rendered in this encounter. Libre's default method of entering charges and diagnoses is to manually search for the codes. Now the visit type codes are already entered, and we're going to call this one established patient detailed. Okay, and you see those pre-configured ones, it drops it right on the fee sheet with the code. But you've got to put in the fee for the office visit, and the provider enters the price, and we'll use this for the ICD code. Okay, you can search on any of the codes that have been loaded into the EMR. We're going to look for an ICD code of Z13. Well, let's just do a partial code and see what it comes up with. Search, and then the search results, you can choose the one you want, which we're looking for 828 or .828, and it puts that ICD code on the form. Now, custom service codes are a capability of Libre where you can select one service descriptor to add to the fee sheet, and all the associated codes and prices are automatically added with it. CSCs are not configured out of the box because different practices have such different procedures. But I'm showing one here because they really are worth the effort it takes to create them. Now, a custom service code can contain several different codes, and they can be any of the types of codes that are loaded into the EHR. CSCs show a drop-down menu on the fee sheet, and I've made one for musculoskeletal issues, and our doctor has a standard treatment for acute low back pain with an injectable medication. See the INJ there. And you select it, and here are the codes and the prices that have already been entered. Okay, the CPT codes for the medication and the injection itself, and the diagnosis that goes with it. Now, if you find you've accidentally entered an incorrect item, well, let's just do that again, just for the fun of it. Okay. Select the unwanted items in the delete column. Okay, and hit refresh. Now, that will indicate that the lined through items, when you save the fee sheet, they'll be taken off. But let's just take a look at it. So you hit save, and then go bring that fee sheet back, and they're gone. Okay, to wrap up the fee sheet here, remember to pick the justifying diagnosis for each code, and this is for the office visit, which the code is the 828, and this is for the injection, and this also is for the injection. Make sure the rendering provider is correct. In some cases, in some workflows, this can be different than the person who is the rendering provider. And hit save. Now the doctor opens the flow board. Let's minimize this. And changes the status. Get this little box back over here to read coding done. Save. And that's it for the doctor. Okay, the next step is our patient goes back to Tom, the LPN clinician, who pulls up the patient summary screen and the current encounter to see what he's got to do. Looks at the doctor's SOAP note right here in the plan. She's ordered a medication. Okay, so Tom goes to the prescription widget, open the med, edit the med, gives the medication, turns this off, it's not currently active, and makes a note in here given by and save. Okay. Now, in this current version of Libre, in the medication listing, you see it got put in there also. That needs to be DC'd also. So you click on that widget, you come in here, click on the medication, you're going to give today's end date, and make the note that he gave it. Outcome resolved today, and save that. Okay, Tom goes back to the encounter, closes his medications, adds a soap note for all the things he did, which basically in this shop they just let him do that. Okay, save the form, and it's official. Sends the patient to the front desk. In the flow board, makes a status change for this young lady. Chart pulled. Again, in real life it would say something a little bit more relevant. Where'd it go? Okay. And Tom's done with this patient. And here's Walter, our front desk man, checking the patient out of the clinic. Finds the patient's record, which needs to be opened to see their fee information. And on the main menu up here, you go to Fees, Checkout. Now, this is the preferred method of payment for cash-based clinics. Let's minimize this. Now, takes her cash payment, and please note that it pre-fills the full amount in. It's going to assume that the account is paid in full, and you got to change that if it's not. Okay, and then hit save, and you can print the receipt if you want. It'll come out on whatever printer this computer is connected to. And he opens a calendar. Could do this by the flow board if you wanted. Opens a calendar, clears her room assignment, clears her status, well, not clears, puts checked out, and hit save. And that's it for Rita's encounter. Now, one last thing. We've seen that the flow board can be a great help for staff to stay informed of where every patient in the clinic is in the course of their appointment. The flow board also generates a report on the data that it collects to assist in monitoring practice performance and for other uses. In the main menu, select Reports, Visits, see there's a visit, then Patient Flow Board. Let's see, we're going to close these out because we don't need them. And this is the Patient Flow Board report. Now you set the different parameters if you don't want all of everything. Okay, provider, all providers. Set a date range for this, and just for the fun of it, we're going to go back a ways. You want to record all the statuses, or just look for one of them, all the appointment categories. You want all patients, and you submit. This is for the basic report. Okay. And you've got all these columns which providers were working and all the final statuses of each one. However, if you go for show details and hit submit, you get a breakdown of all this other information, all the different statuses that they went through, in the order that they went through start and end time of each status, and the total time in each status, and the whole appointment right here. Okay, and that, folks, is what's involved in a basic general purpose encounter in LibreHealth EHR. Thank you very much for your time.